Well, I think I always wanted to be a doctor for as long as I can remember. I mean, I remember being in the hospital when I was, I think, 7 years old with pneumonia, and I thought it was kind of scary but kind of cool at the same time. But I had a great team that worked on me. I remember my pediatrician, Dr. Smith, who took really good care of me, and I was truly inspired by that, and I think it just started the ball rolling. As I got older and started to realize what my true passion was, I realized that becoming a physician is the highest level that I can achieve to help the most people that I can. I've always loved magic when I was a kid. And when I went to osteopathic school, they told us that we're going to use our hands a lot to diagnose and to treat and to use what's called osteopathic manipulations. And they said you need to work on your finger strength, your dexterity, your sense of touch. And I figured, well, it's a great way to incorporate, my magic practice into that. And I feel that, both the art of magic and the art of medicine seem to benefit from it. I was consulted to do osteopathic treatment on this elderly gentleman who had open heart surgery about 4 or 5 weeks before. Since the surgery, he had a lot of rib restriction and had a hard time breathing, and because of that, he developed pneumonia, which is why he was admitted. He was a really mean guy, and rightfully so. But I was able to put my hands on him, find some restricted tissues, and able to release those. The next thing you know, he was taking this big, huge breath for the first time in I don't know how long. He had a complete personality change, and he was walking up and down the halls, with his IV, telling everybody how great I was. In the meantime, then staff is looking at me like, "What did you do to this guy?" So I'll always remember that.